Reporting live from Lassen Med Group. Here we have Dr. Carter with us. He had some time out of his day to go over a couple things that have been going on with the collaborative Coleman project. Number one, what problems were you hoping to solve by participating in this program?
Well, probably the biggest thing was we just realized we were all, if you want to see it this way, spinning our wheels. I mean, we were all doing a lot of work and a lot of activity, but we weren't getting a whole lot of things done. And then the other thing, and this is probably even bigger than what I just said, was we were getting a lot of patient complaints about, I can't get in, I can't get in, I can't get in, and then if they did get in, their wait times were pretty bad. So we were just honestly looking to overhaul that whole thing.
Okay, great. What would you say is the most valuable thing that you've experienced during this collaboration?
I know you want one thing, but there's actually two. One is that just being a part of the process has helped me realize how important it is to, in a way, I know it sounds funny, but take ownership of the practice and to begin to get involved in the aspects of it. And it's really been eye-opening to see how every single person involved is important in the whole process, and how communication's great and accountability and just those things. Now, honestly, the biggest impact thing I've seen is just the personal phone calls to patients. It's helped our no-show rates. It helps our day go smoother. It's just been amazing what that's done to help increase productivity. So to me, that's like been the biggest impact of the Coleman initiative.
Recreating that personal connection between the patient and the doctor.
Yeah.
That's awesome. How will your work in the Coleman program improve the experience or access to the care for the patient?
Well, like what we just talked about, in a way, we've just had lots of people, because we've decreased our no-show rates. That alone has helped. And then we've had, with the simplified scheduling, we've been able to have open slots available every day for same-day appointments. It's just, and with that working together, we've just seen a big improvement in the ability to get patients in when they need to be placed in.
Okay. Now, if you could give some type of advice to another facility wanting to implement this and having the opportunity to be a part of it, what would be your best advice?
My best advice would be go to a program and learn it. I mean, you get involved and learn it, because there's a lot of things. There are a lot of, even though it's a simple process, there's a lot of things to absorb, and I think it's good to get in there. And again, I probably say this too much, but to me the biggest impact is in improving that personal contact with the patient, with communication, with getting involved more with their care. Patients love it. They come with a better attitude. They show up for their appointments. I mean, that to me is the best advice I can give.
That's great. Thank you. We appreciate the feedback. Is there anything else that you'd like to add or tell us about?
Not really. I mean, we talked about a lot. I just want to say thanks, to the Coleman for putting this information in front of us. I think it's been helpful. Again, in a way, it's changed my total perspective on practice. It's got me much more involved in my practice, and I feel like it's also helped me build relationships with my staff that weren't there before. It helps me hear their needs. I mean, it's just opened my eyes to to the whole scope of what a medical practice is like. So I just thank Coleman for doing that for us.
Okay, that's great. Thank you. We appreciate it.
Thanks. A nice microscope, by the way.
Oh,
Gosh, microphone.
Thank you so much.